the panel on essential infrastructure, leveraging worker voice and employer engagement in pandemic response. Today, we're going to talk with experienced leaders from High Road Labor Management Partnerships in healthcare, represented by Rebecca Hansen, Executive Director of the Shirley Ware Education Center and the Education Fund, both partnerships between SEIU, UHW, and multiple hospital and health systems, including Kaiser Permanente and Dignity Health. From Hospitality and Food Service, represented by Aideen Foreman, Executive Director of the Hospitality Training Academy, a partnership between Unite Here Local 11 and its contributing employers in Los Angeles, San Bernardino, and Orange counties in California and across Arizona. And from the Building Services Janitorial Sector, represented by Luis Sandoval. Luis is the Executive Director of Building Skills Partnership, a nonprofit born out of the Justice for Janitors movement, representing SEIU, USWW, and janitorial service owners, commercial building owners, and the Building Owners and Managers Association of Greater Los Angeles. Our discussant today is Aida Cardenas. Aida is the Deputy Director of Equity, Climate, and Job Quality at the California Workforce Development Board. She's an experienced High Road practitioner herself, and she currently leads the Workforce Development Board's strategic investment in the essential infrastructure of High Road partnerships like these represented across the California economy. Our fourth panelist from public transit, Deb Moy, is unable to join us today. Deb and her colleagues at Caltransit Works are focusing on helping their community address the grief and trauma of their brothers and sisters affected by the recent shooting at the VTA Light Rail facility in San Jose. We'll post the Caltransit Works website in the chat where you can find their statement on the shooting, including an opportunity to support the families of transit workers. I'm Pam Egan with the UC Berkeley Labor Center, and it's my privilege to moderate today's panel. We're also supported by Monsi Kathuria and Andrew Yeager, both graduate student researchers from UC Berkeley. So I want to frame the discussion by acknowledging that service, healthcare, and public sector workers are often on the very front lines of crisis, right? And as a result, they're often the very hardest hit. Economic, climate, and health crises exacerbate the tenuous nature of work that's already historically undervalued and increase the burdens already borne disproportionately by Black, Latinx, Asian American, Pacific Islander, and other workers of color, immigrants, indigenous communities, women, youth, and low-wage workers. And the COVID-19 crisis has been no exception. For example, the Economic Policy Institute reports that 80% of the 9.6 million net jobs lost in 2020 were held by wage earners in the bottom 25% of wage distribution. And even as jobs come back, several key demographic groups have recovered more slowly. The Washington Post reports, for example, the slower recovery for mothers of school-age children, Black men, Black women, Hispanic men, Asian Americans, younger Americans, and people without college degrees. On the flip side of job loss, essential work in allied health, long-term care, and home care, among other occupations, put workers in these frontline occupations at enormous risk. According to the Lost on the Frontline investigation by The Guardian and Kaiser Health News, 2/3 of the 3,607 US healthcare workers who died in the first year of the pandemic identified as people of color. Quote, revealing the deep inequities tied to race, ethnicity, and economic status in America's healthcare workforce. Lower paid workers who handled everyday patient care, including nurses, support staff, and nursing home employees, were far more likely to die in the pandemic than physicians were, end quote. The isolation of the pandemic left so many workers and families to face these challenges on their own with limited information and scarce resources. Our panel today, though, represents leaders from labor management high road partnerships who've spent years building worker-centered, job-based labor management infrastructure with those hardest hit workers. Critical infrastructure that overcame the isolation of the pandemic to connect and support workers, communities, and industries through the COVID-19 crisis and now into the recovery. So we're going to have a great discussion. We've pre-recorded a discussion, an initial discussion to guard against technical glitches, and we're going to play that and listen along with you. It's about 30 minutes or so. And following that, our panelists and our respondent will take your questions live. So as your questions come up, please type them in the chat and we'll try to respond to them in order. And Monsi's are also putting relevant links in the chat along the way. So Monsi, if you want to go ahead with the video. Take it away. Here we go. Let's start with healthcare. Rebecca, it's simply not possible to overstate the effect of COVID-19 on healthcare work and workers. Can you tell us about your partnership and what you've done in this circumstance?
Hello, my name is Rebecca Hansen, and I'm the Executive Director of the Education Fund and the Shirley Ware Education Center. We are a multi-employer labor management partnership between 6 SEIU locals and 17 employers. We work statewide in California, as well as in Colorado, Las Vegas, and in Portland, Oregon, across 5 Western states. And this partnership really allows us to directly serve 100,000 allied health workers in everything from entry-level clinical roles, facility services, administrative roles, many workers who were on the front line of this pandemic. And really key in pivoting to create workplace safety and to support each other through what has been a tough year. In our programs that already existed before the pandemic, we're really focused on delivering comprehensive educational opportunities, both for career advancement and skill development on the job. And worker voice and involvement really is key in our ability to deliver those services. And this starts at our board level, where frontline workers serve on our board, participate in what we call our member-to-member programs, reaching out to their coworkers, participating in surveys, joint apprenticeship councils, and focus groups. Really key, one thing we know about the allied health workforce is that their number one consistent reason to engage in our services is to learn and grow to reach their career goals. Many workers, especially frontline workers, enter healthcare any way they can because of their interest in the industry, but face systemic barriers in advancing into higher level clinical roles, and our programs are explicitly structured to overcome those barriers. We also work in partnership with the High Road Training Partnerships in California to focus not only on equity in addressing occupational segregation, but also to specifically serve underserved regions in Central Valley in the Inland Empire. And currently with the transition through the pandemic, to really understand the long-term impact of telehealth and online education for adult learners. And that work is all done through our 501c3, the Shirley Ware Education Center. And we really are focused on measuring the outcomes of our success. And I think one of the things that is really beneficial with a labor management partnership is that we are able to directly measure outcomes working with employers, have really comprehensive data on both job placement, wages, and retention. Specifically, one of our goals is to ensure that we are serving equitably across our population. And so our students, we had 18,000 students complete programs in 2020, really do reflect our union membership, which is 80% women, 70% Black, Indigenous, and workers of color, and around 25% immigrants. We know that for those who are in college degree and certificate programs, we have over a 90% completion rate, and our average wage increases for our learners who move into new jobs is 34%. Importantly, we've also partnered with our employers to be able to see a huge impact on ability to retain workers. So as people move up, they're staying with their employers, they're continuing to grow in their careers, and this is really a win-win for employers and for workers. And then finally, I'll just wrap up by sharing that during the pandemic, at the start of COVID, we were able to quickly pivot because we serve a working adult population. a fair amount of our services were already available online. But we were able to add really specific programs to Pam's point. We were able to leverage our online presence to do webinars dealing with self-care, emotional intelligence. A lot of our workers asked for, and we were able to provide online webinars and sessions really dealing with racism in the workplace, which was also a big concern for healthcare workers, as well as pandemic readiness modules, really helping workers gain comfort about PPE, how they can prevent transmission once the vaccine was available, information on the vaccine, and really helping one-on-one build worker resilience to engage in online learning and make that transition to be able to continue pursuing their education goals even during the pandemic. And finally, I'll just say that, we're really excited about the opportunity to help continuing to support this workforce because they are making a huge transition. One of the huge accelerating factors of the pandemic has also been on online delivery of healthcare. So the same skills that they are using to access our services, I think are going to be key to their resilience and their jobs moving forward post-pandemic. So with that, I'll pass it back to Pam.
Great. Thanks, Rebecca. That's really extraordinary work. I appreciate it very much. And Aideen, let's look at hospitality now.
Take a look.
I was very grateful in April to get the call from the Hospitality Training Academy to come to help work on the Serving Our Community program. This program is fabulous. And what they've done is they've used all these industrial kitchens that we have, like here at the Beverly Hilton, where workers had been laid off. They were able to come back to work and begin preparing meals for some of the most vulnerable members of our community. So now we serve meals to the seniors and to homeless and to folks in domestic violence shelters and to even some of our very own Local 11 members who are experiencing food insecurities. And this has been able to keep many of us employed. Over 1,100 folks have been employed on this program. That's including union and non-union members. And we have now served over 3 million meals.
So, hello, I'm Aideen Foreman. I'm the Executive Director of the Hospitality Training Academy, and I am thrilled to be here with you all. The Hospitality Training Academy is a labor management Taft-Hartley program that works with our contributing employers to move hospitality and food service workers up career paths. We do work with people out there in the community, whether they are prison reentry, whether they're veterans, homeless, survivors of domestic violence or slavery and trafficking, and all sorts of other different marginalized communities, and try to do our best to train everybody up to work in the industry in a union environment with good wages and benefits. And then once they get into the industry, to upskill them to move up the career ladder to whatever they want to accomplish or achieve. So we have currently 2 apprenticeship programs that have been registered and approved by the U.S. Department of Labor and the state of California, Department of Apprenticeship Standards. And those are for a culinary line cook and a room attendant housekeeper program for apprenticeship. We are in the process, luckily through our grants from the state of California, to create 2 additional programs. And those are barista latte artist and bartender mixologist. So we are very excited. We're currently writing that curriculum right now as we speak. During the pandemic, as everybody knows, the hospitality and food service industries were decimated. Flights, airplane flights were decreased, down to by about at least 90% at one point. And obviously hotels in Los Angeles were closed with the safer at home orders and only open to those that were serving like pilots or flight attendants, things like that. So the industry in LA was completely devastated. The union that I partner with, as Pam said, Unite Here Local 11, they have about 32,500 workers, members, and it was down by 90%. So in that time, we kept trying to brainstorm, what can we do to bring workers back to work? There has to be a way to keep at least some people working during this time. So we pivoted. We had never done a meal program in our lives at the Hospitality Training Academy, but during this time we pivoted and we're lucky enough with the state's help to get on this, be procured on as a master agreement with the state of California. And we then were awarded contracts with the city and county of Los Angeles and other governmental entities and foundations. And we have put out, since the beginning of the pandemic, 3.8 million meals. It's been quite a learning lesson. It's been a lot of 24-hour days to get this going and running. But we have taken massive industrial kitchens like USC, Pomona College, the Westin Bonaventure, the LA Convention Center, and a slew of other hotels, and use their kitchens to provide these meals to seniors, homeless, and survivors of domestic violence and trafficking, and low-income families. So with that, we put 1,142 workers back to work and are still providing this program until September as of now. And we have served over 10,000 people on a regular basis. So it's really been our desire to work with our employer partners hand in hand to find ways to bring value to them and to bring value to the union. And so we go after all kinds of different funding sources where we can train those that need the training with both soft skill and hard skill training, just like many of my other panelists that are here. And that, Pam, I think is the HTA in a nutshell.
That's amazing. It's extraordinary work as always, Aideen. Thank you for sharing it with us. And now let's talk to Luis Sandoval. Luis, building service workers were hard hit by both job loss and workplace risk. Can you talk to us about your partnership in the face of COVID-19?
Good afternoon. Thank you so much, Pam and Aida, for inviting me to this session. I really look forward to sharing a little bit more. So VSP is a labor management nonprofit that represents a really unique partnership among over 70 different employers and contractors, the building owners, and SEIU USWW. Each year, we train approximately about 5,000 property service workers, both in workforce development and immigrant integration. The population that we serve and the workers that we represent are largely Latino immigrant workers, women, and workers who are limited English proficient, as well as they have a variety of different digital skills and challenges accessing training. We provide quality workforce development training, such as the Green Transition Program, the infectious disease certification, which is something that came about due to COVID-19, emergency preparedness, and a variety of other wraparound programs. Because we are a similar to our partner HTA, a labor management partnership, we do get contributions from the industry that are negotiated by the workers, and this allows us to really do this work. So I think it's important to recognize this contribution, but also the advocacy efforts of workers, using their voice to negotiate for these funds, right? We work collaboratively with partners and funders to identify, similar to HTA, how to support workers in the industry. How can we insert the voice of workers in workforce development, and think strategically about how we develop our relationships to leverage industry training, as well as reimagine the industry, right? How do we set the floor within the industry? The California Workforce Development Board has been an important partner in moving this work forward. So I think it's important that we highlight that relationship. As you will tell, our offices include, or our training, reach goes from Sacramento, Oakland, Mountain View, San Jose, LA, Orange County, and San Diego. So I'm going to go a little bit into your question specifically around, what are some of the specific pre-COVID, post-COVID needs? Even before the pandemic hit, California property service workers made up a vulnerable demographic, largely immigrant with English proficiency, skills, lack of access to formal education. This industry tends to be low paying, and this creates, a challenging environment for many of the workers that they must overcome. So for us, we approach COVID-19 environment not only dealing with the quality of life issues. How do we make sure that these workers have what they need to make sure that they have a safe, and quality of life. But at the same time, how do we address what's taking place at the workplace? Which what we saw at the time is high infectious rate for COVID-19, as well as making sure that they receive the proper information for COVID-19. So because we had been working through through this labor management model since 2007, and I'm glad Aida's in this panel, but really, Aida really led this initiative for many years as executive director to BSP. During her time, she was able to develop the Green Janitor Education Program, which is really bringing our labor management partners to really think about how do we professionalize the industry and how do we think about janitors in a new light? How do we bring janitors to the forefront and think about how do we include them in the conversation about equity and also include them in conversations about the environment, right? When we're thinking about the greening of buildings, right? Because of that, because of that relationship, because of that leadership, it allowed us, now BSP, during COVID, to really think about how do we now use the success of the Green Janitor Education Program to really think about how do we create a new training program around infectious disease certification, right? So for us, we recently developed this training that is a 12-hour training around infectious disease, and it really, centers around protecting both workers, but also protecting the public, making sure that public is safe, making sure that workers are, receiving the accurate information. At the time, there was a lot of moving pieces around CDC guidance as well as worker protection. So how do we make sure that we protect workers and have the latest and up-to-date information, but at the same time, we professionalize this industry? Again, we partnered really closely with the California Workforce on board, and they were an early supportive of this project and making sure that we protect both the workers and the public. Since inception of this program, we've trained about 1,000 workers across the state of California, which we're really proud. Moving forward, we see the infectious disease certification and the Green Janitor Education Program as being pillars to how we move forward within the industry. So this gives you a very general sense about building skills partnership, but I think there's a huge opportunity when we're thinking about how do we think about moving forward, how do we think about reimagining the industry. I think this is a good example of how do we reimagine the industry and how do we professionalize the industry through training.
Thanks, Luis. Again, really appreciate that extraordinary work, and we look forward to hearing more about that as we have this discussion. Let's turn now to our respondent, Aida Cardenas. Aida, the California Workforce Development Board really began to make a powerful strategic investment in these kinds of partnerships before the pandemic. Can you talk to us about why you made that decision to make the investment, and do these stories validate that decision?
Absolutely. Thank you, Pam, and thank you to the panelists, not just for being here today and sharing some of your work, but really the hard work that's been done that you all do on the ground, they've been doing them for decades and really lifting up the model of what workforce development should look like, right? And as you mentioned, Pam, the California Workforce Development Board made a decision back in 2017 to invest and look at some demonstration projects, look at how workforce strategies are being integrated in with using partnerships to really address issues of equity, climate, and job quality, and really ensuring that there's a structure built in place that allows for worker voice. All of our panelists spoke about the importance of addressing worker needs and their participation in looking at building out these strategies to meet industry needs and industry demands. I do want to really highlight that all of these projects also, as our initial demonstration project, showed that in a moment of crisis, we're able to use that table, we're able to use that structure, we're able to use that practice of working together and looking at both, looking at employer needs, looking at industry needs, looking at what workers need, we're looking at what community needs, and working together in the win-win initiative. And that is what we're investing in. That is what we want to see expand and take to scale in different industries where folks can really come together. And it's really turning the workforce system or traditional workforce development upside down, in the sense that we're not starting with training and just hoping somebody's going to land in a job, or saying any job is better than no job. And we're saying, no, that's not enough. That's not what our communities need. That's not what workers need. Employers need good, solid employees, and workers need good, solid employers that invest in them. So I'll share a little bit about sort of our scale, where we've come from and where we're going in terms of state investments. but I'll just add too, and we'll add that to the chat, information regarding our high road training partnership model. We've worked closely with UC Berkeley Labor Center and UCLA Labor Center in the last 4 years or so to really take a deep dive to learn from these partnerships so that we can really develop that story, the best practices, and develop this field of practice for industries that are looking at doing the same. How do we come together to create an impact that's going to be resilient, that's going to go beyond any initial investment, that it's not just about running 100 people through a certification program and getting them a job, that it's really about building a structure and infrastructure within an industry with worker voice at the table, that's going to be an added value to everyone. So I want to share sort of where we've come from. Okay. So these are the demonstration projects that we started investing in back in 2017 to really look at and learn from the work that Rebecca, Aideen, and Luis have done and others, right, in building out these partnerships. So we started with, this is our first cohort of high road training partnerships that the State Workforce Development Board decided to invest in. And going into this year, and so these are the projects and partnerships that you heard from today, and that really were in practice when the COVID crisis hit. And in this last year, and looking at investing another $19 million in high road training partnerships as part of our California climate investments, is we really looked at where are areas that need investment. Rebecca shared about going inland, going into areas that need that support. Aideen talked about going deeper within industries, using and leveraging the partnership with all of those employers that see the value in partnering and identifying this is what we need in terms of workforce development in our area and creating career paths. And learning from Luis in terms of, what is the critical needs right now to reopen California as we get out of this pandemic, and how are workers protected, not just service workers, at the front lines, but also as we repopulate office buildings, as we repopulate, airports, as we repopulate stadiums and arenas and hotels. How do we do it safely and in a way that folks feel confident? So as you can see from here, we're looking at a variety of industries, new emerging industries like offshore wind energy, really looking at, as we move into more, putting more electric vehicles and large electric vehicles into California streets. How do we make sure that we're protecting communities that are impacted by trades and logistics, right? Looking at what are going to be the needs in terms of putting some of these electric vehicles, right? We need to talk about energy storage. We need to talk about the infrastructure and construction and a variety of industries. So as you can see from here, our investments right now, putting out $19 million this year to these partnerships, are going to be key to continue to expand this field of practice. And where we're going now, in the governor's May revise, the high road training partnerships has come out as a flagship workforce program. Why? Because it's building back better. It is doing things differently. It's not training and hoping and praying that someone's going to get a job and it's going to make a difference in their lives. It's making industry changes for the long haul. And so we're very excited to see the governor wanting to invest $115 million in high road training partnerships, in addition to another $15 million for high road training partnerships to partner with the community college system, along with a lot of other workforce investments. So we're excited to see where this is going to take us, where this momentum is going to take us, but really lifting up the stories and the great work that our partnerships do on the ground, to continue to invest in them and invest in the workers that are going to bring California back.
That's amazing, Aida. Thank you so much. It's pretty impressive investment, and to see the growth over just a very few years is amazing. I want to say that Luis Sandoval with Building Skills Partnership has a key meeting that he has to get to, so he's going to jump off for this part of the discussion, but he will be with us for the live discussion and answering questions in a week or so. So again, thanks for really putting that into context, Aida. So let's just get into a discussion. Monty, if you want to bring us all back into gallery view. So this is really about system change, right? We heard Aida say this is about turning the workforce development system on its head, doing things very differently. And I'd love to throw that question out there. What does that mean? What does that look like? Rebecca and Aideen, do you have some comments on what challenges or what changes we have to make to really make that a substantive system change?
So I can jump in on a little bit of our frustration and concern in the hospitality and food service industry. So a lot of the money that we all receive is this WIOA funding, right? The Workforce Innovation and Opportunities Act funding coming out of the US Department of Labor. But a lot of that funding is done on a formula basis and goes to the local WIAs or the workforce development boards for them to use. And that money is, at least in several of the areas that we work in, it is dished out entirely to work source centers or one stops or AJCs, whatever we want to call them in the term of the day. And that money is not being used to fund our systems, our labor management partnerships. And so a lot of the work that we're doing is entirely outside the system. It means your workforce development boards aren't capturing those placements. It means that there's no buy-in from the system. It means that we're operating in a very siloed atmosphere. And it's incredible that under, Governor Newsom and that the state WIB is investing in these programs where, just like Aida said, right, we don't train for the heck of training. We train using curriculum that our employers and the union have all approved that's designed to move them into a specific classification. And it's hard to find other entities other than labor management partnerships that get 100% placement like we do. I mean, we literally, every class we do for apprenticeship, we know that there's jobs there. We've trained for those jobs. Employers are ready to take our trainees, and it is a perfect fit. But what we do see is that we are outpacing the system, and we're outpacing the system as a whole. So I'm going to give you an example. In the period between July 1st, 2020 and March 31st, 2021, which is what we have the latest data on, the LA County Workforce Development Board and its 16 American Job Centers trained 1,168 people in LA County. Now, that's nothing to sneeze at, but the HTA alone, not even counting Luis's Building Skills Partnership or the building trades, the HTA alone trained 2,295 people. We trained 1,127 people more than Los Angeles County, which shows that if there was a real investment by the WIBs into labor management partnerships, then they also A, could claim those placements, and B, we would even have more money to train even more people, and we are doing better than the system as a whole. So I guess my frustration and hope is that when we look at reauthorization of WIOA, when we look at how the local WIAs are spending the money, my hope is that when there are labor management partnerships there and Taft-Hartley funds, that they will look to those entities to put their money and to provide more funding for these marginalized, vulnerable populations to get the training they need to get good quality jobs.
Great. Yeah. Rebecca, any thoughts from your perspective?
I mean, I applaud the comments already shared. The only thing I think I'll just sort of piggyback on, it's not even really an ad, is just how important collective bargaining in the labor management partnership is to the work that we do. And I think historically, or not, in recent history, prior to the pandemic, I think in general, there was a reluctance to talk about unions and the role unions can play or the role collective bargaining can play. But I think that as we've seen sort of the impact of the pandemic, as we've had change in leadership nationally, I think there's a growing interest in understanding, like, how are we empowering workers? How are workers at the center of how we develop and deliver workforce services, and how are we focused instead on sort of a model of like skills deficit instead of like what are the jobs that we want in our how do we want jobs to function, how are we building jobs that are supporting families and supporting career advancement opportunities. And so I think the labor management partnerships, I think, like to Aideen's point, are doing a really, really great job of that. And I think we are, through the HRTP, trying to figure out how we take that model forward in the rebuilding of California, along the lines of what Aida shared. So I'm very excited to really just be in a position to share our experience and our work as a model for how we move forward and ensure that workers are at the table and designing those programs, and employers are at the table with jobs for workers who come through our training programs.
And Pam, I just wanted to jump in to say one other thing is that we also just use our own training fund accounts or our Taft-Hartley accounts to pay for things that even WIOA won't pay for. We have ESL, we have computer literacy, we have financial literacy, we have all kinds of classes, that are not covered in many of the standard WIOA formula allocations. And it's just one of those extra benefits that we bring to the table as leverage for the entire system.
Right. Rebecca?
Thanks. I'll just add one little thing to that too, which is we also invest in long-term programs that it takes people several years to become a respiratory therapist or a registered nurse, right? Like this isn't something that can be done in 12 months or even sometimes in 18 months, right? And so we're really investing in long-term career growth. And to Aideen's point, building in all the supportive services that help people get in those pathways, and really investing in the clinical training and other training that they need to be successful. And that really does pay forward in terms of how patient care is delivered in the future in our country, where we have a patient care workforce that actually reflects patients.
Yeah, and I think that's a great example of when we talk about why this model, right? And think that having industry at the table, and I think all of the 3 projects we heard from today, all of them have investment from employers and from multiple employers who compete with one another, right? But say, okay, this is the standard of skill that we need, and we need to upskill our current workforce. So a lot of the work is also or a lot of the training is invested in incumbent workers. And so we like to see it as, upskill and backfill. It creates entry points and more opportunities for disadvantaged communities to have an access point into these industries, but the importance of not just leaving workers there on their own, of looking at the different, supportive services or other training that's really going to affect multiple generations. When you have someone that's invested in and they're in this job and they get an opportunity to have a career path and create some upskill and some job stability and better job quality and voice at work, it really has an impact on their entire family, right? In terms of being able to make changes for the future of California. So I think that's another example why this model is really important. It's not easy, right, to do. I mean, work has been going on with these projects for a couple of decades. So it is work, and it takes that commitment, that investment on the front end. And as Aideen shared, in terms of being able to have results, is you get further faster. Why? Because the High Road Training Partnership Model, will add a link to what we found were, I had mentioned earlier, working with Berkeley Labor Center around like what are the essential elements of a High Road Training Partnerships. And it starts with industry-led solutions. It's having employers and workers at the table identifying what is our issue today that we need and where is our industry going, so that we can have some foresight in the future of work and begin to develop a workforce development strategy that's going to align today and immediately, and then having access to the workers because of the employer engagement right away is really important. So I think that all of these examples speak to why this model is, we see as an important model. And the challenges we have up ahead to figure this out in other industries, but we're up for the challenge, and just very excited that we have leaders like Rebecca, Aideen, and Luis and Deb Moy, who couldn't be with us today, and many others who are really leading these efforts. And we need to lift them up as a model, and we need to invest in them.
That's terrific. Thank you for that really great glimpse into the work that you all do and how that is continues to make a huge difference and made a huge difference through the pandemic. So let's open it to questions. We've got our participants and panelists, and we've got the first question in the chat. Heather, and I apologize, Heather, if I mispronounce your name, Grobe. Do you have a sense of how long-term the employer's commitment is to partnering with labor? Anyone want to take that one on? Rebecca, your project's been around for a very long time. You want to start with that?
Sure. Yeah. We've been operating since 2006. And even prior to that, there were some projects done through the workforce system, actually, that sort of predated the formation of our labor management partnership, Taft-Hartley Fund. And we were modeled on a model that's really well established on the East Coast in New York and on the with 1199 New York. But we basically have had a super long-term commitment, starting with Kaiser Permanente and what was at the time Catholic Healthcare West, and now expanding to 17 employers. And so what we've seen is over time, employers increasing their commitment. And I think it's really driven by two things. One is sort of the point Aida was making around the future of work. In healthcare, at least, there is a deep understanding of the real need for to have a partnership with labor to manage change in delivery of care, change in patient needs, like there's a whole host of things that are constantly going on. And I think what we've seen also in healthcare, and the same is true in education, a lot of self-reflection and how do we do this better moving forward? And we can't do that without partnership with our workforce. Even in places, I think, where you'd see a lack of a union partner, you still see healthcare employers trying to figure out how to partner with their workforce, because delivery of care obviously is really, it's a service business, right? So anyway, I think over time we've seen an increasing commitment. We're currently, like in my training partnership, we had added Planned Parenthood in one region, and we're now adding them in 5 states because of the results sort of speak for themselves. And once employers understand the opportunity to take advantage of the economies of scale of being part of a 100,000 person training fund, it's sort of a no-brainer for them to join. And so, yeah, we've experienced, I think, when I joined the education fund, just to put it in context, it was a $12 million annual fund in 2015, and we're currently a $30 million fund. So we've almost tripled our employer contributions over that time period, really through a growing understanding of the value, which is such critical, a critical thing to share, but also the need. Okay, I'll stop with incumbent workers. Yeah.
Great. Aideen or Luis, both of you also have longstanding partnerships. Do you have anything else to include there?
Just that contributing and partnering with the HTA comes through the collective bargaining agreements. So I think that once the property is union or goes union or is union to start with, I think the employers view it as a very long-term commitment for, I don't think they see there as an end date on it. It's really trying to figure out, paying into the fund, what do they want to get out of the fund? What kind of training do their employees need? Where is there pain in their company that we can help with? Because I'm sort of digressing a little bit, but a lot of employers do training. They bring in these trainers and it's all about what can the workers do to make the company more profitable? What can the workers do to make sure that their work is, better and harder, and they, work faster and more efficient? And all of that is great, but it comes from the angle of what are you doing for the employer and nothing about the worker. And so what we try to do is make everybody ensure that the workers, in order for them to buy into the training, to be more efficient, to do all of the things the company wants them to do, the training has to be also about the worker and making them giving them a career pathway, showing them that hard work will lead to positions in management or will lead to better job opportunities for themselves and adding to their resume. So what we try to do is really get everybody to buy in the fact that when we train, we're really just training to make sure that everybody's happy with it, not just the union, not just the management, but everybody.
Super. Thank you. Luis?
Yeah, I would just kind of piggyback on what Aideen mentioned. I think, our work is anchored by the CBA. We couldn't do this work without the CBA, the collective bargaining agreement, right? And I think, we got to also recognize workers and that they themselves advocate for these contributions to the training fund. We couldn't do this work without that, lifeline that we have, which is the contributions through the CBA. And I would just say that, this really is, a result of their advocacy and their commitment to investing in themselves, and then wanting to take agency and also having voice in the collective bargaining process, to include, this training fund into the CBA. So.
Excellent. Thank you. Thank you. And Aida, on the same point, before we move on to the next question, it seems to me that the work that the Workforce Board is doing to help others understand this work and bring it to other sectors could increase multiple employers' long-term commitment to doing this work, to investing themselves. Does that make sense to you?
Yeah, absolutely. And I think by having the partnership and having the employers at the table, identifying what their challenges are and being able to have, an organization that understands the industry in a very direct way and including the workers, right? It allows for the workforce strategies to address the needs immediately. And what we've seen is in these partnerships is that there's been growth. We don't really see them go backwards. And it is a different table than a labor management negotiating an agreement. That's a mechanism, right, to build that table to work together. So this is really a win-win strategy, and sometimes challenging, right? But like, what's going to work for all sides? And in a lot of our work and our partnerships is looking at labor management, but also community. How is the community around impacted, and how do they have access to the jobs? But what we've seen is actually growth in employer commitment and contributions, and they're willing to invest because they see the value that they get out of it. And that's what we want to see in these partnerships, is that it's a win-win to build a resilient industry that builds a resilient workforce, that builds resilient communities.
Excellent, excellent. And your point about bringing in the needs of the community is a great segue to the next question. Virginia Parks asks, it was mentioned that these programs focus on incumbent workers. Is this true for each of the programs represented? How or do these programs engage unemployed workers and then place these workers into jobs? So who'd like to comment on that one first? Rebecca, we'll go back to around the same circle?
Sure. Yeah. And I'll just say briefly, where we have done work with, unemployed workers or community members is really where there is a pretty big movement in healthcare. And I think for many healthcare organizations, they see themselves as an institutional anchor. So many have community hire programs, and we have in many cases been able to partner through grant dollars like HRTP and in other, funders, philanthropy, and even through the workforce system to serve non-incumbents. And then our union partner and some of our employer partners have sort of launched a separate, pretty extensive $130 million multi-year project to train community members as entry-level healthcare workers. So there is sort of another effort underway that we partner with that is in another 501c3 structure, if you will.
Excellent, excellent. Aideen, and then Luis.
So I would say that the HTA is about 50-50 of incumbent workers and then finding new workers to move them into the hospitality sector. We do a tremendous amount of, upskill training or ServSafe or TIPS or any kind of certifications employers need for incumbent workers. But we also work with over 100 different CBOs and AJCs and churches and whatever it is to find folks for our training programs, because we know employers need to hire those folks to train them up, and then to get them the resumes, the mock interviewing, and then to get them placed. And then also obviously retention's a big issue. So we not only work with employers, just like they might need 5 people, so we go through our clients looking for those people, but we also help many of our employers with hiring fairs. For example, we've done the hiring fair for Dodger Stadium for all of the concessions for Levy restaurants. And in that process, we did all the pre-screening. We gave all of our clients, the ticket to get to the front of the line to get the jobs. And we helped Levy go through 5,000 people to hire 1,500 people. And we had a tremendous amount of success getting our clients hired when we ourselves help with the job fair. So it's really, we really have different ways that we interact depending on what's the best way for the employer, but it's pretty massive when we start doing 5,000 people job fairs.
Absolutely. Luis, I bet you've got some good information for us.
Yeah, I mean, I would echo what both my colleagues mentioned, which is we largely work with incumbent workers. Although I got to say that we are pretty nimble in terms of addressing the needs of the industry, and that may be doing some recruitment fairs or also trying to figure out how to attract new talent into the pipeline within the industry. So, we probably will see more of that over the next couple of years as we see the evolution of the industry, and also how workers are starting to transition out of this industry, and the labor shortage that we're seeing within certain industries, for a variety of different reasons. So I think we're going to probably see more of a demand to do more recruitment fairs and also entry points into the industry. But as of now, we're pretty nimble in terms of how do we address the needs of the industry.
Great. And Aida, any comments there in terms of some of the new partnerships that you're bringing online? That my understanding is there'll be partnerships that focus both on new workers and on incumbent workers. Is that correct?
Yeah, it's all a mix. Some of it is reskilling, upskilling. When we look at moving to electric buses, for example, when we look at the operators and the mechanics, we want to make sure that those workers are retrained, right, for those, so that new technology. In addition to new workers into electric bus manufacturing, right, as it becomes a growing industry. So yes, it's about meeting the industry where it's at and addressing what they need, in terms of reskilling or creating career paths, but also creating equitable access into these jobs.
Great. So the model works for both incumbent and new entrants. Great. Heather asks, are fund are the funds third party managed, or does your labor management partnership manage directly?
Are they talking about an investment manager?
Or maybe
You mean like a third party
intermediary?
I was thinking an investment manager, intermediary of some sort.
We have an outside investment manager for funds that we carry over. Most of us are trying to spend all our money as soon as we get it, and that's true of my organization as well. But we do have an outside investment manager for funds that we carry over.
And for the HTA, we have our own fiscal team that does all of our tracking for our grants, and down to every line item and budget. But we also have a third-party beneficiary company that does all of does the bookkeeping and writes the checks and all of that. So we have a big checks and balances system.
Yeah, I would say.
Yeah, go ahead, Lee, please.
Same thing as HTA, we have our own team internally, and then we also have a third party accounting system. And I would just say that, like for us within BSP, we also have multiple check and balances within the team. So.
Excellent. The next question, let's jump to the next question. Are you aware of this type of partnership in southern states? Can you describe any challenges related to that, or any challenges related to traditional employer and union roles? Any thoughts?
I can say I'm aware of on the in Florida, SEIU Healthcare Labor Management Partnership around training that happens. I think with University of Miami, and it's like the big county hospital in Dade County maybe has does training. And what was the second part of the question?
Challenges related to traditional employer and union roles.
I mean, it's challenging in the sense that sometimes we're sort of, in the process of doing something in partnership while our partners are also, our key kind of stakeholders in that work are also, struggling over other issues related to the collective bargaining agreement or other workplace issues. But I would say that one thing that I think we've seen in the commitment by the employers was a question earlier. And I think, Aideen and Luis really responded well to the fact that it is because of the workers' commitment to the work. Like, I think what we've seen is that we still often, even in the midst of pretty extended labor issues that are being resolved, taking time to resolve, that we're still able to move our work forward, that there's a joint sense of win-win and commitment. And I think that is because the workforce, like to folks' point earlier, like the workforce commitment to the work and the employer understanding how important that is.
Great. Luis, Aideen, I messed up my order, so jump in.
Okay, I'll jump in then, Luis, then. So we also have a partnership. Boy, and Miami seems to be the hotspot of the South. So we have a partnership with the Miami Union down there. They have a program we're called the HTA. They call theirs HEAT, HEAT. And we have done classes for them online for many of their workers, and they also have done a culinary training program as well. So that definitely is happening in Miami. And then as for challenges, we really, really, really try to stay like Switzerland, like laser focused on training and not get into any of the any potential issues. Rebecca said I don't know I can't remember how you described it, but, CBA related, concerns or however we want to call it. We try to avoid that at all costs. I mean, the one thing that we found is that the workers that we train, the people we train that become workers are some of the best workers the employers have. They are consistently winning Employee of the Month. They are consistently being the top workers. So the employers are reluctant to say, okay, I'm not going to work with the HTA right now while I'm fighting with the union, because they know that the workers they're going to find on the street that haven't gone through our training and preparation are not going to be as good as the ones they're going to hire. So I think it helps us a little bit get through any potential dust up issues that come along the way.
Great.
Yeah,
Luis?
within SEIU Building Services, I would say 32BJ, they have a training fund in Florida. So, they would be our counterparts, and we, collaborate all the time on our own programming and curriculum. So I just couldn't tell you exactly the reach in Florida, but 32BJ would be the point.
Super. Thank you. And Zach Zobrist has asked about whether the concept of the High Road Partnership was a choice California made under the WIOA model. Aida, I see you responded in the chat there. And he also asks, do we need our policymakers to adopt this criterion of HRTP? What ways can I use WIOA and other levers to help create incentives that reward Taft-Hartley funds or help use workforce to drive up standards in an industry, create better jobs through workforce development?
Yeah, I'll try to keep it brief, but in short, the State Workforce Development Board use its WIOA discretionary funds to say, look, let's fund some of these projects and really learn from them and get their DNA. And so we posted the essential elements. And if you look at our High Road Training Partnership page, has a lot of information, including an evaluation. But what that did was it shows look, this is how we get further faster. This is how, it is doable. And having industry at the table and having an organization, right, that wakes up every day, goes to sleep every day, working on behalf of that mission and that objective of the partnership, so that as folks are doing their thing, whether they're business or labor and doing the things that they need to do in terms of their role, that there's this place where they can come together that has, you know, a purpose that's for both, right? And having that organization is really important. And what we've seen that now in the state of California is now we see the conversations coming into policy, saying as a state, you know, procures, or as a state looks at investing in industries, how do we attach job training and making sure that there's a particular model, that there's worker voice at the table, et cetera, as we've defined what high road training partnerships are. But I think that this helps inform the best practices and how to do it, so that policymakers can really take a look. So we've definitely seen a lot of interest. Obviously, we've got a lot ways to go for folks to really get deep in understanding what it means to have worker voice at the table. But that's how we got started in 2017. And so we're, you know, seeing some momentum from state leaders.
That's great. Well, we've come to the end of our time, and we have some additional great questions in there. We'll if it's possible, if folks can maybe type a couple of quick answers in the chat, I would refer you to the background materials that we have uploaded to the LIRA site, and you can find contact information for these programs where you can learn a little bit more and maybe get some of those questions answered. As Aida and others have said, the California Workforce Board, at the UCLA Labor Center and the UC Berkeley Labor Center are doing a lot of work to try to build out opportunities for other people other practitioners and interested parties to learn about these projects. So reach out to our sites as well. And I think we'll leave it there for the end of the day, with great thanks to all the participants and great thanks to all of the panelists and our respondent. Proud and impressed with the work you do. Thanks for bringing it to all of us.
Thank you. Thank you, Pam. Thank you, everyone.
Thanks, everybody.